begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. In this episode, I will discuss various kidney disorders and COVID-19. I apologize for pushing this episode back, as I had promised this episode would have been done a few days ago, as some have contacted me via chat on the Acupuncture is My Life app. Now, if you don't have this app, simply go to the Google Play Store and download it to learn more about acupuncture and to access chat sessions to ask questions you may have regarding acupuncture and whatever ailment you may be faced with, and interested in seeing if acupuncture can help you manage that ailment. Now, before delving into the coronavirus and kidney disease, please take a moment to view my earlier episode on the basic functions of the kidney in Chinese medicine. Now, several individuals in which I chatted with on the Acupuncture is My Life app were concerned as to whether they're at an increased risk of becoming infected with this virus as a result of various kidney issues. Now, as I'd informed everyone in which I chatted with, I'll inform you. I'm not a medical doctor. I'm a state licensed, board certified doctor of acupuncture. So if you have or are experiencing complications of your kidney disease and are concerned, please contact your physician immediately to discuss the matter. Now, from what I understand, individuals with kidney disease or any other severe chronic medical condition are at risk of severe illness as a result of becoming infected with this virus. Now, individuals on dialysis tend to have more compromised immune system, which would make it harder for them to deal with this virus should they become infected. Speak with your physician regarding special precautions in which you can take during this time. Now, I've read reports stating that patients in China who had been hospitalized with COVID-19 were also confirmed as having acute kidney injury. Acute kidney injury can be a marker of severe COVID-19 infection, whereby the mortality rate is higher in these patients. There are COVID-19 related effects such as inflammation and blood clotting, which are thought to contribute to acute kidney injury. If you suffered from acute kidney injury as a result of having been infected with the coronavirus, I recommend you speak not only with your physician, but a nephrologist, which specializes in kidney function as well, because long-term complications of acute kidney injury can result in the development of chronic kidney disease. Now, there have been cases of COVID-19 patients who did not develop acute kidney injury, but blood and or protein had been detected in their urine. I've been asked if COVID-19 can cause kidney failure, and to my understanding at present, the answer is yes. Some individuals have suffered from a sudden loss of kidney function. Now, when you get a moment, please view my episode on acupuncture, the coronavirus, and the kidneys. And of course, I've been asked a lot, have I ever treated anyone who has suffered from any form of kidney injury as a result of having been infected with this virus, or have I treated anyone during this pandemic who are presently suffering from some sort of kidney disorder? Now, the answer to the first part of this question is no. The answer to the second part of this question is yes. Now, I was also asked if acupuncture can help individuals manage kidney disorders as an adjunct to allopathic care, which they have already been receiving. And the answer to that question is yes as well. Now, I'd recently treated a patient who'd been diagnosed with acute nephritis by their medical doctor. Now, acute nephritis is inflammation basically of the kidneys. It mainly presents as edema of the face and eyes with blood in the urine. Now, when it comes to Chinese medicine, this patient presented, let's say, with clinical manifestations of dampness. She presented with edema of the legs, with a distended feeling in her abdomen. She had scanty urination, nausea, and a feeling of overall heaviness. Her tongue had a sticky coating, so I knew I had to focus on resolving dampness and invigorating yang to promote urination by needling points on the conception vessel, the bladder, stomach, and spleen channels as well. Now, another recent case in which I'd received consent to briefly discuss was chronic renal failure. Now, chronic renal failure from a traditional Chinese medicine perspective is viewed as a succession to spleen and kidney deficiency with the accumulation of turbid dampness, which tends to be complicated by recurring invasions of exterior pathogens. Now, exterior pathogens can cause lung qi to be deficient, thereby causing a failure of water metabolism, leading to the accumulation of dampness, which would ultimately affect the functions of the Sanjiao channel, which is the upper, middle, and lower burners. Now, I had diagnosed this particular patient with kidney yang deficiency with the accumulation of turbid dampness. The patient appeared with pale lips and pale nails, shortness of breath, weakness of the extremities, fatigue, and an intolerance for cold with cold limbs. There was also nausea, vomiting, and diarrhea. He had a white greasy coating to his tongue with a weak pulse. I knew I had to focus on tonifying the spleen and kidney yang, as well as promote urination and reduce edema. Now, both patients appear to be doing fairly well and will continue receiving acupuncture treatments along with the allopathic care in which they're presently receiving. Now, when you get a moment, go to my website at acupuncturesmylife.com and click on Understanding Acupuncture to learn more about different disorders relative to the organs from a Chinese medicine perspective. And don't forget to go to the Google Play Store and download the Acupuncture is My Life app, as well as subscribing to this channel. And until next time, acupuncture is my life. What's yours?